Services. My daughter's not breathing. Please hurry up.
Now pump the chest hard and fast. 1, 2.
She's collapsing.
Stay calm, stay calm. We're getting help to you.
More than 2 million emergency calls are made every year in Victoria, the fastest growing population centre in Australia. One call every 12 seconds.
701, we're right.
We've gained access.
On the front line, paramedics respond to more than 800,000 patients every year.
It's okay, you're going to be fine.
And we'll get some oxygen on straight away.
By air.
Oh yeah, sighted. Yeah, visual.
And road.
Oh, he's going to crash.
Move across.
In a race against time.
No!
For some patients, life is on the line.
Is that helping a bit?
I want you not to move your head at all.
For others, it's a helping hand that's needed.
Yeah.
You here for Mr. No Pants guy?
An unprecedented number of fixed-rig cameras
Put your hands down behind your side.
give unrivaled access
You better drive it like you stole it, dude.
to the daily lives of these emergency service heroes.
We're helping you breathing, okay?
On this episode of Paramedics,
It looks like you're having a heart attack.
a life and death struggle for Taz and rookie Amanda in a challenging location.
I'm acutely aware that there are parts of Michael's heart that are currently dying.
In the bed.
Mike and Jamie help out a colourful character.
So what's going on tonight, mate?
I am beat my
1, 2, 3.
And a parent's worst nightmare when their 2-year-old daughter is found unconscious.
It's like I gave a goodbye kiss in a helicopter to never be seen again. It just breaks your heart.
Emergency services.
I've got an elderly man here. He's not responding. His eyes are a bit glassy. I'm fairly sure he's baked himself in the sauna.
Right, okay.
It's the start of shift for Taz and his new partner, rookie paramedic Amanda. Their first job tonight is a bizarre one.
He's baked himself in a sauna.
Does it say that?
Yes. He's baked himself.
Like a potato. Baked in a sauna. I don't even know what that means. So I don't know what to expect. First for everything, eh?
It may sound like a strange case, but with a patient who's not responding, the paramedics have been given a code 1,
Oops.
Whoop days, after you. Idiots.
which means lights and sirens are authorised to ensure a rapid response time.
Yep.
Anytime.
If we just want to move, that'd be awesome. Thank you. Being so new to the role, I find every day is a challenge. I'm still learning so much. There's a lot of things that I haven't yet dealt with. It's potluck what you get every day.
Within 10 minutes of receiving the call, Amanda and Taz arrive at the aquatic centre.
Is he conscious?
He's baked himself in the sauna. He's just real glassy-eyed.
Okay. Hello, how you going? This is Michael. Hi, Michael. What have you done? You're in the sauna.
I did some exercise in the pool first before.
Okay. How are you feeling now?
How much energy?
Do you have any medical conditions?
Suffering from gout and high blood pressure.
From gout and high blood pressure, that's everything? No heart conditions, no diabetes, nothing like that? So a bit of an unusual scene. It's hot, really hot. Like Thailand, middle of typhoon hot.
To try to work out what's caused Michael to suddenly collapse, the paramedics check his blood pressure
What day is it? Tell me. It's Wednesday, good.
and attach electrodes to monitor his heart rate.
Just checking your temperature, okay?
So I start to notice that Michael gets a little bit more lethargic.
35.9.
I think something a little bit more serious could be going on. Are you in any pain anywhere? In your chest? Can you point to the pain for me?
Taz and Amanda are becoming concerned their patient is rapidly deteriorating. The situation is now critical.
So, Michael, it looks like you're having a heart attack, my love, okay? It's not good, but you're with the right people. We're here to help you, okay?
Patient Rudy.
Yeah, he's a known caller. Just says he's feeling his heart race and states he banged his head on the table earlier today.
In Melbourne's CBD, Mike and Jamie have been called to investigate a man who has apparently hit his head and is now experiencing chest pain.
Address is usually at a boarding house.
Okay, right. Sweet.
Every 50 hours, a paramedic is assaulted while on the job in Victoria. So Jamie and Mike will be on high alert for possible threats when they walk into the unknown.
As a paramedic, we go to a lot of different places, most of them wonderful, but some of them are dodgy. Walking into a boarding house, we've always got to have that risk assessment going on because people will sometimes try and hurt us, and we've only got each other to look out for.
Yeah, so it'll be this one then.
Our safety is the most important thing because if we get taken out of action, we can't look after anyone else.
Across town, Taz and Amanda are desperately fighting to save Michael.
It looks like you're having a heart attack, my love.
The 63-year-old suddenly collapsed after being in a sauna.
To what, sorry?
An IV access.
When I see someone in that situation, I go straight into the clinical mode because every second counts.
All right, Michael, just know you're in good hands, okay?
Michael doesn't realise what kind of grave danger he's in. The consequence could be fatal.
Keep talking to me, darling. The main thing we obviously want to avoid is Michael going into cardiac arrest.
Amanda attaches defibrillator pads in case they need to send an electric shock to the patient's heart to restore its rhythm.
His blood pressure's really low.
At the same time, Taz puts Michael on an IV drip to try to raise his blood pressure.
Keep talking to me. Do you have any children?
I have 2.
You have 3 children.
Amanda talks constantly to Michael to assess his level of consciousness.
What's your wife's name?
Put in the IV access in now.
I'm divorced.
You're divorced, are you? Sorry to hear that. You're doing a really great job.
You're doing a good job too.
Oh, thank you. I must say, Michael, it's actually very nice to meet you. I'm sorry it's under such horrible circumstances. It's a good sign that he was able to have a conversation with me. Tell me about your children. Talk to me, Michael. However, Michael's conscious state is dropping off. I want you to keep talking to me, Michael, okay? All his vital signs are dropping and very, very close to cardiac arrest. Open your eyes for me. You just stay with me, okay? I'm acutely aware that there are parts of Michael's heart that are currently dying. You get a blockage in the heart's not getting blood flow, it's not getting oxygen, and it starts to die.
Paramedics Jamie and Mike have been called to a boarding house to check up on 41-year-old Rudy, who has a history of chronic drinking.
Going to drug and alcohol jobs, it can be really challenging. These people can occasionally be quite belligerent, be aggressive, and we've got a responsibility to go and treat them.
Rudy, do you mind if we come in?
Yeah.
Yeah?
They might not have called us themselves, so they might go, who the hell are you? What are you doing here? So it can be really dangerous sometimes. RC701, we've gained access.
Have a seat somewhere for us, Rudy. Sit on the edge of the bed for us, mate.
Knives on the bed.
Just keep nice and still, Rudy.
Your knives are okay, mate. They're just on the bed there.
You're definitely watching out for dangers. I usually just try and cover them, so that way if they're going for the knife, at least I know that they're going for the knife and I've got time to run. What's going on, Rudy?
My chest is very painful, and my head as well.
The pain in your chest, Rudy, what does it feel like? Does it feel punching, stabbing, sharp? What does it feel like?
It's like a knife coming.
Like a knife. All right.
It soon becomes clear that Rudy presents no threat. This is a patient crying out for help.
Do you take any tablets? Whereabouts are they?
As well as his battle with the bottle, Rudy suffers from diabetes and epilepsy. Combining that with the bump to his head and chest pain, Jamie decides Rudy needs to be examined further.
We'll drive you up to hospital, Rudy. How does that sound? They'll look after you, okay? We'll give you a blanket in the ambulance and we'll drive you up to the hospital, okay?
Everyone's a bit different and you can't really judge a book by its cover.
After you, mate. You don't need your sunnies. It's dark out there, mate.
That's something that's really important to me. All people have the right to healthcare and they get the best healthcare from us.
In the bed, on the bed in there, mate. There we go. Good job, Rudy. Have a lie down. Pop your sunnies on. It's nice and bright in here.
Very nice. And these bloody classes, you know, it's a ladies' classes.
Yeah.
But they look very nice.
They look nice on you, mate.
Sometimes they do look nice,
They
don't
look beautiful on you.
Rudy is absolutely amazing and he absolutely rocks those sunglasses. It makes me want a pair.
So what's going on tonight, mate?
I am peace, mate.
Rudy is turning out to be an entertaining patient.
I had a crazy mate.
Why do you say that for, Rudy?
I say to myself all the time. You reckon that I am crazy?
No, I don't think you're crazy at all. Do you think I'm crazy?
Of course not, mate.
Of course not. Say yes, Rudy.
While Jamie and Mike bond with Rudy, back at the aquatic centre,
Sharps out.
63-year-old Michael has collapsed after a sauna and is now dangerously close to cardiac arrest.
I want you to keep talking to me, Michael, okay?
Taz and Amanda are working to keep Michael alive while specialist help is on the way.
We're just waiting for a Micah paramedic. Have you ever heard of Micah paramedics before? They're the ones that are super duper.
Mobile intensive care ambulance paramedics undergo years of training so they can deal with critical medical emergencies.
This is Michael. He's 63-year-old male. He's got no medical history other than gout and hypertension.
That's good enough.
Yep.
Thanks to Taz and Amanda's quick response and treatment, Michael is already showing improvement.
That's it. Well done. Good job. Just up onto the stretcher.
Okay.
Taz, thank you. It's all right. I'm coming with you, my love. I'm going to drive you in.
While the Micah team monitor Michael's condition on the way to the hospital, Amanda is responsible for getting him there as fast as possible.
Pull over, pull over, pull over. Come on, mate. When you've got a patient in the back that's time critical, it's a sticky situation, you're tense, you're dealing with all of the traffic considerations in front of you, but always very aware that you need to get there as soon as you can.
Vital information from the heart monitor is being sent live to the hospital to speed up treatment when Michael arrives. Meanwhile, back at the aquatic centre, Taz is now packing up the ambulance and processing what's just happened.
The 6 leads can open the secrets of your heart. A dying heart. As you know, life is very precious. I think at some stage you start to feel a little bit emotional and a bit proud also. Thinking inside that, thank God I'm a paramedic. Thank God I'm a paramedic because today, I think I saved a life.
By the time the Micah ambulance arrives at the Austin Hospital, Michael has made a remarkable recovery.
We got you here nice and fast. It's a really good feeling at the end of the day to be able to go, you know, I've just done a 14-hour day, it's been long, it's been a horrible day, but I've just saved someone's life. That's pretty special.
Michael will now be admitted into the cardiac unit to ensure he's out of danger and determine if surgery is required.
You were going to go where next week?
Next, the bush.
The bush. You still might, as long as it's nice and relaxing.
We're not too far now, okay?
Okay.
Jamie and Mike are on their way to the Royal Melbourne Hospital with chronic drinker Rudy.
The only one thing that I eat is a lot of pork.
It's not bad. I like pork.
You know, I fry it.
Oh, yeah?
Beautiful. I put chili.
You know what? Next time you call an ambulance, you should cook some up. How does that sound?
That sounds good.
Yeah, it does sound good, doesn't it?
After plenty of laughs,
oh, Rudy.
I am happy. Always happy.
Always happy.
the mood suddenly changes.
No, sometimes I'm sad, mate.
Sometimes? Why you get sad for?
When I think about my kids.
Yeah. How many kids have you got, Rudy?
3.
3. Do you see them often?
I don't want to see them because the more I see them, I miss them.
Oh. As fun as Rudy is and having a laugh in the ambulance, you know, he obviously is quite sad at his life situation. When was the last time you had something to eat?
I eat chocolate, mate.
Eat chocolate. When was the last time you had a good sleep, Rudy?
4 days ago.
Why haven't you been sleeping?
I can't sleep, mate.
Is that why you drink? I tend not to look at people in a bad way. These people don't choose that life. Like, sometimes they've just had a wrong choice or a wrong decision or just something bad's gone on in their life and they've just spiraled out of control. How long you been drinking for? A couple of years?
More.
More?
So I want to stop it.
Ah, okay. They've got no one that loves them, they've got no one to care. So I think these people are the ones that need the most sort of reassurance, and even just a touch of the hand and say, you know, everything's going to be okay, we'll take you up to hospital, is enough for them to sort of change their whole outlook and potentially bring them back up. Howdy. Where are the sunnies? You got to pop them on.
Rudy. No, mate.
You look sexy.
It's too dark, mate.
It's too dark.
Too dark. We'll find you some well-lit rooms. We arrived at the hospital and we'd actually gotten to know a lot about Rudy in the kind of short transport time. He was just actually a lovely bloke who'd had a lot to drink. He was a big fan of you, that bloke.
Ah, I love drunk people like that. They're just so pleasant. You can just have a chat with them, have a laugh. Like, as long as they're pleasant and they're okay, like, I don't mind. Just, you know, sometimes their life's pretty rough and they just need somebody to care about them. And
happy to help anyone that wants to help themselves.
Still to come on Paramedics.
He had a knife? Yeah. I tried to take that knife.
You've put your hands out to try and grab the knife, and that's what's happened.
Amanda and Taz are called to help the victim of a home invasion stabbing.
He has some serious lacerations to his fingers.
And heartbreak for a mum as her tiny daughter is emergency airlifted to hospital.
Just looking at her with the tubes in her mouth, I wasn't too sure what the outcome was going to be.
Every night, more than 200 ambulance crews respond to distress calls throughout Melbourne. Some of those jobs will be critical. Others will just need a helping hand.
Received and thanks.
For paramedics Nat and Leonard, their next assignment is coming to the rescue of an 85-year-old lady who has fallen off her chair and can't get up.
Nancy, is it?
Yeah.
Nancy's daughter Lynette tried everything to get her mum off the floor.
Yeah, I got my neighbour to come and help me because I thought we'd be able to get her up. We tried every way. We got her halfway onto the couch, but we couldn't get her up. So I said, oh, I'm going to have to ring and get them to come out.
Even a non-emergency patient transport crew has struggled to solve the problem.
Nancy, how did you end up on the floor?
I
tried to get up off the chair.
Right.
And I slipped.
Slipped just down, did you?
Yeah. I went down.
Yes. Didn't hurt yourself, did you?
No.
Okay. It must be really hard getting to a point in life where you can't do the things you've been used to doing, where you can't easily get yourself up off the ground.
In their attempt to lift Nancy and avoid injuring their backs, Nat and Leonard are going to deploy their secret weapon.
So what we'll do, Nancy, it's a bit complicated. We're going to put this slide sheet underneath your bottom. So there's going to be a couple of things going under your legs, one going around your back, and then we're going to slide you. It all seems a bit much, but we'll talk you through it one by one.
We have this handy little device called the Elk. It's a lifting cushion. It is amazing. It has changed our lives and saved our backs. We love the Elk. Am I hurting you, Nancy?
No,
You're okay there, love?
A bit of a massage there, but... I think it's very embarrassing to tell a patient like Nancy, hey, we're just going to lift your buttocks and put this weird machine called the Elk underneath.
Look at that.
I think that's perfect. All right, everyone happy to start going up level 1? Once we plug the machine in, it starts to make a brrrr noise. And the look on Nancy's face when the machine started to fart and lift her up, I don't think she knew if it was the machine or if it was her.
Oh. Beautiful.
Yeah, I was watching the footy.
Yeah. Who won?
Collingwood.
Oh, you're not a Collingwood supporter, are you? No, North Melbourne, that's all right. I don't have to leave now.
Now, do you feel comfortable standing up?
I'll try.
Okay.
Hold on. There we go.
How do you feel?
All right.
Do you feel wobbly or you feel like your normal
No,
self?
I'm all right.
Don't run. Don't run. Okay?
I want to know where you're going to go.
Anywhere.
He just wants to walk.
Away.
To run.
Away from us. I've been to many jobs over the years where elderly people just have no one to call. So it was so lovely to see Nancy's daughter Lynette on scene and know that she was looking after her mum.
All right.
We're done?
We'll get out of here then.
Happy?
Let you be.
Brilliant.
No worries.
Thank you.
Thanks, mate. No worries.
Thank you.
No
You're
worries.
so
Thank you.
welcome.
See you later.
For doing that. Great outcome. Mum's happy, I'm happy. And thank you to the ambulance for coming in and helping Mum.
Well done, Leo.
Yeah.
Good job.
It's a nice job.
Excellent. This job is certainly not all heroics, action, lives being saved. Everyone's version of an emergency is different. So as long as we're there when they're going through a tough time, then we're doing our job. How good was the mango elk for that job? Because it means that we're not lifting.
Well, as they say, you've only got one back.
Who says that?
I don't know. I just made that up.
They say?
I was kind of hoping you'd kind of go
I'd
on
know.
There. Yeah, inferring that don't screw it up.
You're back?
Because when you do, you don't get your back back.
You don't get your back back? Yeah.
We just got a job, a stabbing.
I received a stab wound during a burglary at code 2.
Received code 2.
It's a new day for Taz and Amanda, and they're already on their way to a home invasion victim.
So this could either be like blood spurting out everywhere.
Or the bandit job.
I'm going for blood.
And TM49,
Yep.
We won't be having a Kill Bill Volume 3.
Kill Bill Volume 3. Paramedic black humour, we call it. It's a bit of just coping mechanism, a bit of self-preservation.
Let's go.
Yeah.
The stabbing victim has managed to get himself to his local police station.
My name's Amanda and this is Taz. What's happened?
When the team arrive, they find 35-year-old Sri Lankan refugee Ganesh bleeding from multiple stab wounds to his hands.
What was it cut with? Metal, glass?
Knife.
A knife, a knife, okay.
Ganesh was on a day off from his job packing mushrooms when an intruder entered his home.
I saw him, then he coming and fighting with me.
Ah, okay. And he had a knife?
He took my mobile, everything.
He had a knife?
Yeah.
Okay.
And you've
then
put
I
your...
tried to take that knife.
Yeah.
You've put your hands out to try and grab the knife and that's what's happened. Okay.
Despite attempts to take on his assailant, the thief still got away with Ganesh's phone and car.
You're very lucky that he just got your hands, huh, with a knife. How lucky are you that you haven't lost a finger, you haven't sustained a worse injury, you know, in the arm, in the chest, in the hip? So the cut itself, Taz, is actually quite clean.
It must be from a sharp knife.
Yeah. We're going to need stitches at the very least.
You can't do anything for them. You can arrest him.
We can't. We're the ambulance.
We're the paramedics, Ganesh.
We can't arrest anyone. Now we need to go to the hospital, okay?
It remains to be seen if there's any permanent damage to Ganesh's hands. With his ability to earn an income in doubt and no family in Australia to support him, Ganesh's dream of getting residency has suffered a major setback.
Although Ganesh's injuries weren't life-threatening, they're definitely life-impacting. In order for him to be here, he needs to work. So these injuries that he's sustained could actually jeopardise him being in Australia at all.
Emergency services.
My daughter's nothing in it.
Okay, tell me exactly what happened. She's not breathing, is that right?
Yeah, I noticed vomiting. I just went in there. She's breathing really funny.
A frantic mum has rung emergency services after finding her 2-year-old daughter unconscious.
We'll get some help organised, so just take a deep breath.
The Melbourne-based air ambulance is being dispatched to the caller's location, 190 kilometres away in the Victorian country town of Shepparton.
She's not awake. Her teeth are like closed shut.
Okay, is she breathing?
She's slightly breathing. Can you please hurry up?
So, ma'am, we are getting some help organised for her.
Micah flight paramedic Matt and his crew are on board.
Not 100% clear on what's actually happened at this stage with regards to how the child's become unwell. A crew on scene, they're actually already gone ahead and given the child some drugs and put them in an induced coma and put them to sleep and put a tube down the throat to support their breathing. You know, the ultimate place for this child to be at, rather than being at a rural hospital, is to go down to the Royal Children's Hospital.
Helicopters are called out for life-threatening emergencies that can't be dealt with at local hospitals, with crews responding to more than 2,000 each year.
The work that we actually do is considered to be the sickest of the sick patients. When you get dispatched to a paediatric case, there's always things that go through your mind thinking, oh, is this similar to the age of my children? And, you know, what if this was my children as you get dispatched to it? So it automatically increases your heart rate and your anxiety about the job that you're about to go to.
After 30 minutes, the helicopter arrives at Shepparton Airport. The local paramedics are already on the tarmac, standing by for the Micah helicopter team to arrive.
Hey mate, how you going, all right? That's the way.
Inside the ambulance, 2-year-old Mackenzie is now in an induced coma, with the paramedics controlling her breathing.
So Mackenzie has been well, no problems up till this morning. Mum's found her, she's had vomit over her mouth, over a pillow next to her and breathing funny. So she's done about 5 compressions of CPR or so.
Sure.
And we've arrived, she's got a pulse.
Righto.
Mackenzie's distressed parents and family friends are standing by, helpless. For Mackenzie's mum, Bree, this morning there were no signs of the nightmare ahead.
Went off to playgroup. She had a great morning, and then we came back and she had lunch, and then it was just a kiss goodnight and she went to bed.
Have a listen.
Then, as I normally do, I always go in and check on her. I noticed that she was doing this really strange breathing. I went closer and then there was vomit over her pillow. And she was all floppy and I was just like saying, come on, wake up, wake up. And yeah, she wasn't waking up. Petrified. Petrified that, you know, the worst was going to happen.
We've sucked her airway out a couple of times now and she's got pretty good airway, but I've had to really keep the ventilation up to her just to bring her end tidal down.
She's got blood pressure, GCS 4, cerebral posturing, with eyes deviated to 10 o'clock, roll to the right, but no seizure activity.
And there's been no stiffness other than the decerebrate posturing?
Absolutely.
The guys at scene mentioned decerebrate posturing, which indicates there's a bit of pressure onto the brain or the brain isn't functioning the way that it normally should.
So if we can just start transferring to our monitor, and that's it, just a little bit of elevation there.
It makes us concerned that maybe there is a lack of oxygen to the brain or there's a bleed in the brain. So it heightens our concern about what's going on with the patient. Depending on the degrees of bleeding that people can have in the brain, people can have a very bad outcome from that, and obviously it can lead to death.
Officers in Epping are trying to piece together the moments leading to a man turning up at the police station with a stab wound. The victim in his 30s arrived with a wound to his hand. Paramedics were called, and it's unclear if anyone's been arrested.
How long have you been in Australia for?
5 years.
5 years.
Sri Lankan refugee Ganesh has made news bulletins in the country he now wants to call home.
So you're in the process of getting your visa for Australia, permanent residency for here, and then you can go back to visit. So you haven't been back in 5 years to visit?
No.
Wow. Mum and Dad are also overseas? Yeah. Wow. Do you miss them?
Yeah.
Yeah. Do you like it in Australia, other than what's happened today?
Yeah, nice country.
You poor thing.
Ganesh will soon find out just how serious the damage is to his hands. If he can't get back to work packing mushrooms soon, he may not be able to stay in Australia.
You feel for somebody in his situation, you know, such an innocent soul who's come here to try and change his life for the better, and he's just gone through this horrific event, which would be traumatic for anybody. We're coming into the hospital now, Ganesh. My heart hurts. I feel bad for you. Come on, Ganeshwaran.
Let's get you sorted, yeah? Let's get your hand fixed.
He just has so many things going against him already. You know, he's left all of his support network behind. Come, please. And to have something like this happen to him in his own home, he just doesn't need it.
From immigrant point of view, when we're getting prepared to come to Australia, we are always told that it's a beautiful, safe country.
Come to Australia. We've got such a beautiful multicultural country. It's really safe and you'll live a beautiful life there. Sandy beaches, beautiful reef, and then you get burgled and almost lose your fingers.
It's not a perfect world, Amanda.
It's not a perfect world, and this job definitely opens your eyes to that, doesn't it?
It does.
Things that really get to me are those things that make you challenge humanity and realise that, hang on a second, the world's not as good a place as you think it is. My heart is aching for that poor boy.
Being a casual worker, you know, and his hand will be, you know, heavily stitched, he won't be able to work for next few days.
Absolutely.
That's his wages gone.
I don't reckon he'll be able to work for at least 2 weeks. And that's if there's no, further damage. Yeah.
Let's get young Mackenzie out of the truck here and onto our stretcher.
A flight team are preparing to airlift 2-year-old Mackenzie from country Victoria to Melbourne after she was found unconscious at her home.
1, 2, 3.
The cause is still unknown. Mackenzie's dad, Dean, was at work when he received the news from his wife, Bree.
Bree's call, I wasn't even going to answer the phone. Something made me just answer it, and then just pure panic.
So she's not breathing for herself at the moment. We've got control of all of that, and her heart rate and blood pressure's all good at the moment.
Okay.
In my guts, I just felt sick. Walking around the house as I was working on it, and I was looking at where she does paintings and on her little table, and she's got like her little crayons, and I'm like, how am I ever going to come back to this house to see this if she's not going to be with us?
It's Mum Bree who'll fly with her only child to the Royal Children's Hospital.
It'll be about a 30-minute trip back to the Royal Children's.
It was extremely hard to let your girl be just taken away from you, out of your sight. I knew she was alive, I knew she had a heartbeat, but I didn't know if that was going to continue. It's like I gave her like a goodbye kiss in the helicopter to never be seen again. So.
Taxi forklift.
It just breaks your heart.
Beautiful afternoon out there, isn't it?
Like a fluffy ocean.
Yeah, very much so.
As the heart-wrenching journey to Melbourne gets underway, paramedic Matt attempts to reassure Bree.
Everything is working okay, heart-wise, oxygen-wise, and all those sorts of things. It sounds like she's had a seizure of some sort and has vomited, but that would be my interpretation.
A lot of children have seizures, and they can have seizures for many different types of reasons. When someone has a seizure, they've got disorganised electrical activity going on in their brain, so we try and give them medicine which will sedate them and calm them down.
They'll do a CT scan of the head and work out that everything's going on okay there.
There's lots of other things that it could potentially be, but I'm hoping that it is a seizure activity that's going to resolve and Mackenzie's going to come out of this okay.
She's never been in a helicopter before, so she doesn't get to appreciate it. Oh, well, you'll be able to tell her all about it afterwards.
Mackenzie is just a joy. She's our world. I was just thinking, we can't be losing her.
She's got the painted nails and everything.
Yeah, we painted them this morning.
Nice. I've got 3 young kids as well. And, when you look after young kids that are a similar age going through nasty accidents, you just manage looking after the patient at the time. But it's not until you walk away that you actually think about things after. It hits home.
Kids are the worst. I hate seeing kids injured in accidents. Anything that involves children getting hurt is probably the ones that I come home and get upset about. So they're the hard ones to deal with.
Just looking at her with the tubes in her mouth, my mind was racing of all the things that could happen and what's her future going to be like if there's a future. Yeah, I wasn't too sure what the outcome was going to be.
It's a sigh of relief as we actually land at the Royal Children's Hospital. You'd just love to give a reassurance to say everything's going to be all right. But I can't give that 100% guarantee that everything is going to be okay. I think given that sort of circumstance, I would be a blubbering mess. It's not something any parent should really have to go through in their lifetime.
Oh, hi, Michael.
Hello.
You look so well.
Yes, my champion. I need a hug. My lifesaver.
It's only been 3 days since Amanda and Taz saved Michael's life after he suffered a near-fatal heart attack.
Taz? You're buddy for life.
Yeah, we are.
Yeah.
Michael has been administered blood thinners to unblock a clogged artery to his heart and is now on the road to recovery.
Look what we found. Being able to meet Michael was a really, really special moment for me.
I actually, when you told me it's a heart attack, I started to reason with him up there. I said, I don't think it's my time yet. I've got a few more things to do.
Yep. Well, he agreed because you're here. Yeah. I've only been in the job for a short period of time, but it really made me realise I love what I do. It's really humbling. It makes you realise that the world and the universe is bigger than you, but no matter how small you are, every little person can make a difference.
I can't thank you guys
No, you don't need
anymore,
to. That's our job. Now, what we did, anyone would have been in the same situation would have done the same.
You guys are very, very special.
To be honest, people like you give us the inspiration to keep going.
Yeah.
I'm so happy to hear that.
Yeah.
I definitely felt proud to see breathing Michael. Because of this blue uniform, someone is actually thanking me for saving their life. And that's why if you ask my daughter, what's your daddy's favorite color? And she'll say blue. And I love to be paramedic.
It's good news as well for Taz and Amanda's other case, Sri Lankan refugee Ganesh, who was stabbed in his home. After requiring stitches for severe lacerations, his hands have now healed completely, allowing Ganesh to return to his mushroom packing job and stay in Australia. So far, police have not been able to track down his attacker. And it's been 1 week since 2-year-old Mackenzie was found unconscious and airlifted to hospital.
The last time I saw Mackenzie was as I handed her over to the hospital staff at the Royal Children's Hospital. This is one of the cases that I want to know that she has a positive outcome. I want to hear that everything's okay.
1, 2, 3.
Yay! The doctors told us that it was a possible seizure, what had happened, but there was no injury to the brain. Her chest scan was clear. All her bloods had come back normal. So it was positive in that way, but then it was also, well, why did this happen? And will it ever happen again?
Hello, Mackenzie. How are you? Do you remember me? I guess you don't remember me at all. I've got a little surprise for you. Oh, wow. That's a big teddy.
While Mackenzie's been cleared of epilepsy, what doctors can't tell Bree is whether her little girl will suffer any more seizures.
Can I have a hug, please? Oh, thank you.
Now that we're back home, we've become these like helicopter parents. I crept in on her the other day when she was having her day nap and I must have made a noise and she kind of looks at me and she's like, Mum, what are you doing? And I was like, no, it's fine. You're fine. It's all good. Go back to sleep.
Oh, and another step.
Today, Matt's going to get Mackenzie airborne again. And this time, she'll remember the trip.
Now, if you look over there, behind that crane is the Royal Children's Hospital, and that's where we flew you to in the helicopter.
The paramedics were fantastic. By far the worst moment I've ever been through, but surrounded by the greatest people that we've had the pleasure of meeting.
We're just, forever thankful. So thank you so much.
The work they do and how they do it is just mind-blowing. It takes a special breed of person to do what they do. We owe our daughter's lifetime.